It's time for Pet Prescriptions. We're answering any of your pet health questions at 756-1212. Dr. Michael Wilkie is joining us. He has expert advice for you for free. Call us at 756-1212 if you have any pet health questions. Obviously, temperatures almost to 100 degrees this weekend. We really got to watch the pets.
You really do. You've heard me say this before. Particularly the dogs are not very efficient coolers. They have very few sweat glands. They don't handle the heat very well, particularly when the humidity is high. Fortunately, a lot of people have air conditioning, and I see a lot of dogs that stay in the house. That's a good thing. The flip side to that, of course, is that these dogs, like us, if they're used to air conditioning, are not very well acclimated to the heat. So if for any reason they should go outside, if you put them in the car, if you go somewhere on the weekend, make sure these dogs have plenty of water and shade. Shelter from the sun is very, very important. Pay particular attention to the hair coat, particularly long-haired dogs.
Oh, yeah.
They do pretty well if the coat is in good shape. What you don't want is an unkempt coat, hair mats, that kind of thing. Make sure they're taken care of. Some people ask me, should I clip my dog down? Should I give him a haircut for the summer? You can certainly do that, but make sure that there is some hair length left, because that hair coat acts as an insulator against the heat as well as the cold.
All right, let's go to the phone lines where Tony is our first caller. Hi, Tony.
Hello.
Good morning.
How can we help?
Well, I have a question about fleas.
Okay.
We have treated our house, we have treated our yard, and we have treated the dogs. I mean, it's a constant battle. And we have Scottish Terriers, and she has pulled the fur out of her front paws all the way up to her body.
Are you still seeing fleas?
To give her some relief.
Are you still seeing fleas on the dog?
Yes.
Okay. Well, you're not alone, if that's any consolation. Everyone seems to be having a particularly difficult time with fleas this year. We've gotten some rain after several drought years, and the fleas are back with a vengeance. It sounds like you're doing all the right thing: environmental control, house, yard, and of course the dog. Several questions come to mind. If you've got any other animals in the environment, particularly cats, make sure that you're treating those as well, because sometimes a cat, for instance, can be a sort of reservoir for fleas, and they may or may not be scratching, so you may not be looking carefully at that. You may have to repeat some of those treatments. I'm not sure what you're using, but it's not unusual to do what you've described and then repeat it again in 2 weeks or so. Make sure that the topicals, I'm assuming you're using topicals, there's some excellent products for use on the dog, that you're using those in a timely fashion. And if you've just started this, don't give up hope. Sometimes it takes a little while for this to get into the pipeline. If you have carpets in the house, make sure you're vacuuming those carpets regularly. That's very important, and the mechanical action of the vacuum cleaner will actually help to kill the fleas and the larvae.
Let's go to Melba now. Hi, Melba.
Hi.
Morning.
How can we help you?
I'd just like to ask the doctor, I've got a little Shih Tzu in the house, and I keep him groomed and everything, and I keep his flea medicine on him, but he scratches a lot. What could I do for that?
Very possible, don't know for sure without an examination, that you've got a flea allergy situation. Very, very common in dogs, particularly the smaller breeds, and they can be extremely sensitive to the flea saliva. It only takes 1 or 2 bites from fleas to set this whole scratching storm off. So you might try some Benadryl, 1 milligram per pound, 1 milligram per pound. If there's any confusion on the dose, call me. It might help. Very often, if it's the usual type of flea allergy, dermatitis as it's called, inflammation of the skin, other medications are required. But if you're doing a good job with flea control, still scratching, it could be allergic to other things as well, but the little Shih Tzus are very commonly sensitive to things in the environment.
756-1212 is the number to call if you have any questions about your pet's health. Give us a call at 756-1212. How often, if there are no problems, do we need to bring our dogs in for a checkup?
They need to be seen at least once a year, and people will frequently call the office and they'll say, I want to bring my dog in, how much are shots? That's all they're thinking. There's much more to it than that. Timely immunizations are important, but when a dog comes into your veterinary office, that dog also receives a complete physical exam, head to toe. And we're listening to the chest, we're examining the skin, we're looking for, just like we would go in. Also, blood work is a very good idea to check liver, kidney, blood sugar, total protein, blood count, things that you can't always assess just with a physical exam. Now, as these dogs age, we're recommending that every 6 months is not too frequent, because like us, as we get older, things happen.
Yeah.
Things happen. And a year in a dog's life, particularly an elderly dog, a lot of things can happen. So usually 8-year-old dogs or older every 6 months, all others, and cats too, annually.
All right, thanks so much for joining us. Here's the information for Dr. Michael Wilkie. He's at the Red Bank Animal Hospital on Dayton Boulevard. RedBankAH.com. Get you more information, or 877-8174. And of course, stay with us. We'll take a short break and we'll be right back.